Hi, and welcome back to the third video in the 12th lecture of Covidenomics. What I'd like to do in this last video in this course is to reflect on some of the lessons that we should take out of the experience of COVID-19. How do we adjust our systems, our institutions, to create a more robust and resilient society that is going to be ready for the next disaster, whether it's a pandemic, bushfires, or something completely different. I'm going to do this in two parts, by first considering how we should prepare for the next pandemic, and secondly, what we've learnt about how we respond in terms of policies to the next pandemic. Let's start off with preparation. One key lesson from the COVID-19 pandemic is that we want health systems and other systems that are flexible, that they're able to respond relatively quickly, that can ratchet up and down in terms of capacity, but are flexible in terms of the way that they deal with different groups in the population. This issue of flexibility is what Stuart Butler from the Brookings Institute looks at in this article in the Journal of the American Medical Association Forum. His first point is that we need to think about hospitals and other institutions and the idea of hubs. Where should people go when they first feel sick? Should they be going to hospitals, or should there be more community-based medicine? There's been some examples in Australia to show the benefits of flexibility between hospitals and community-based medical facilities. For example, in northwest Melbourne, there's been a great system of coordination between in-community health facilities and the hospitals to not only allow for better testing for COVID-19, but also to then be able to triage patients, work out which ones need hospital care who are at high risk, and those who are able to better quarantine at home with support in the community. That more flexible system, where you basically have a central hub with the patients then approaching the hub and then moving out as required, can be a more flexible and sensible system, not just for COVID-19, but for a whole range of health conditions. Second, Stuart Butler looks at telehealth as being a key component of flexibility of the health system. During COVID-19, telehealth has come into its own. By telehealth I mean GPs and other medical practitioners interacting with patients using telephone, video conferencing. Sometimes the patient is assisted by, for example, a trained nurse. Sometimes it involves the use of applications to be able to improve diagnosis or allow for distance diagnosis, and sometimes it's just face-to-face, for example, face-to-face psychological counselling. The experience of COVID-19 has shown that telehealth not only makes the system more flexible, but it makes it more accessible for consumers. And there's a strong argument that we should increase access to telehealth in an ongoing way. And the final area that Stuart Butler looks at relates to government coordination, government funding, the flexibility of that funding, the ability of state and federal governments in the United States to be able to work together and respond in a coordinated way. Again, this is in line with the Australian experience. Early on in the pandemic, we had a significant change of institutions, with the National Cabinet being formed between the Prime Minister and the heads of the states and territories. That led to that sort of coordinated approach, which overall has helped Australia be fairly successful dealing with the COVID-19 pandemic. That being said, it hasn't been smooth and they haven't always agreed with each other, but it's still a significant improvement. Second area where I think we need preparation is that we need to have the right rules in place, rules that can be invoked when needed in a crisis to enable governments to respond appropriately. The most obvious one of those that I've referred to in earlier videos relates to government data rights. We've seen how governments in East Asia, for example in Korea, South Korea and Taiwan, have been able to use data to protect the population. Now, this doesn't mean ignoring privacy, but it does mean that we have to make sure that the data is available to government, to authorities, for use when they need it, with the data then being purged when it is no longer needed. A third area of preparation is to consider what we want to be as a society and to try and develop norms, robust social norms, around what we want to be as a society. Okay, that's really vague. Let me try and explain what I mean. In an earlier video, I looked at the importance of mask wearing as a way to prevent the spread of SARS-CoV-2. Remember, the idea behind mask wearing is not that it protects the person wearing the mask, but it protects others from that person if that person happens to be infectious. So it's a great example of where an individual undertakes actions to protect others, not to protect themselves. It is a straight out externality. In fact, you're doing something that is harmful to yourself, or at least costly to yourself, to protect others in society. Mask wearing is a lot more common in East Asian societies than in most Western societies, such as Australia, the US, and most parts of Europe. However, it actually goes back, at least in Japan, to the Spanish flu epidemic back in 1919, 1920. So it's only really 100 years old. So it's not a long-term cultural trend. And indeed, if you look at other East Asian nations, yes, there was more mask wearing before the COVID-19 pandemic, but it wasn't a huge percentage. It wasn't like everybody, if they felt some symptoms of a cold or flu, wore a mask, or even the majority of the people, if they had symptoms, wore a mask. No. Here's the numbers from South Korea. So from this survey, only about 19% of South Koreans actually wore masks both before COVID-19 and after COVID-19 when they felt they had symptoms. Rather, 70% didn't wear masks before but realised their importance and wore them after the pandemic broke out. And only 11% didn't wear them either before or after. An article in Time magazine puts this difference down to different social norms. In other words, they argue that the wearing of face masks is encouraged, for example, in Hong Kong, which is the East Asian country referred to in this article, that wearing face masks is encouraged in those countries because there is a history of it, albeit, as I've already pointed out, at best it's only a 100-year history. Whereas Time says it's not as accepted in the US because Western culture prefers the recognition of faces, the importance of leaving the face and the eyes exposed. I'm not too sure many people wear masks covering their eyes, so I'm really not sure that this is a great explanation. An alternative explanation offered by Paul Krugman in the New York Times is that mask wearing is looked down upon in the US, that requiring people to wear masks is looked down upon because of a strong libertarian streak, that individuals automatically protest and push back against being required to do something forced on them by the government that they would not otherwise choose to do for themselves. And he argues that, in fact, there should be requirements for mask wearing, and that it shouldn't be enough to simply say, well, I don't want to wear a mask, because by not wearing a mask you can kill other people. Again, it comes down to that externality. Not wearing a mask creates a pretty big negative externality if you're COVID-19 positive. Now, I think both of these arguments relating to culture have some grain of truth, but I think they miss the key point. The article in the Times gives a great case study of somebody in the US from an Asian background who chooses to wear a mask because they think it's the right thing to do. And that person says that they get treated very differently at work, that they've had people spit on them in the street or cough in their direction, that they're being shamed because they're wearing a mask. And I think that's what we really need to think about when I talk about what sort of society do we want to live in, and how that can help prepare us for the next pandemic. Because we essentially need a society that's tolerant and willing to consider other people and our impacts on other people. So one element that's highlighted is the stigma associated with mask wearing, which is an expression of intolerance. So I think societies that are more likely to be successful in the next pandemic are those that have social institutions and social norms that minimise stigma and, in a sense, create, maintain and spread tolerance and diversity. And the final bit of preparation is what I'll call data readiness. This is different from the idea of data rights. Data readiness is having the systems in place so that we're able to gather the relevant data, whether it's health data for a pandemic, whether it's meteorological and forest data for bushfires, or whatever the data needs to be. That we have systems in place to gather data and to analyse that data and to turn that data into policy. Now, certainly in Australia, we have great data in some places, but even where we have good data, for example, in parts of the health system, we're not great at turning that data into evidence that is used in policy and then using more data to evaluate policy. So we need to move into a data-ready society because it's only through data, through evidence, that we're going to know how best to tackle the next pandemic or the next bushfire or the next hurricane. And it's going to be too late if we say, oh, the pandemic's on us, gee, we better start collecting data now. We need to be thinking about what data we need to collect now, not only to maintain and improve our current systems, but to prepare those systems for the next pandemic, bushfire, hurricanes, whatever. What about in terms of policy responses? Well, the first area of policy response that we need to think about is to make sure that we have credible policy options that are based on looking at the costs and benefits of alternatives. Now, let me pick the obvious example, the first lockdown in the pandemic. And listened to a talk last night by Gigi Foster from University of New South Wales, who was running through some of the arguments relating to that first lockdown. And I ran through some of those in earlier videos in this course. And there is a strong argument that the first lockdown may have costs that outweigh the benefits, although there's also a strong argument that the first lockdown was necessary because we simply didn't have enough information. But in hindsight, the costs outweighed the benefits, but we weren't sure of that in advance. I actually think the more important part, as I hope I made clear in this course, is that it was the only credible policy option. We had to have some form of lockdown because otherwise we would have put massive pressure on our healthcare system, and no government could risk the bodies piling up and expect to survive politically. So policy options, yes, we've got to think about the costs and benefits. Yes, we've got to think about uncertainty, but we also have to make sure that they're actually credible. The second element of policy responses really just reflects the data readiness from preparation. If we've got a data ready set of systems and institutions in place, we then need to make sure that we tap the appropriate sources of information and we use data-driven policy to make the best policy choices during the pandemic or other emergency. The third factor is to take input from a range of parties. And in a sense, certainly here in Australia, the governments have been following the science, but the science has been talking to the epidemiologists. And we've shown the weaknesses of the epidemiological models in this course, but we've also shown that the approach of the epidemiologists reflects both their own professional incentives and their own professional objectives, And so it takes into account very much the health consequences, but not the economic consequences. And it reflects, in some ways, their own biases, so that they don't have, for example, endogenous responses, individual responses to their policies. So we need input from a range of parties to the government. Yes, we needed the input from the epidemiologists. We also needed input from other health experts, such as mental health experts, who have been trying to get more public awareness about the mental health consequences of a strict lockdown. We need the economists at the table, of course I'm going to say that, but we also need other professional groups who can all provide different perspectives and different input to government decision making. There is a significant literature in corporate governance that has shown that diversity on boards leads companies to make better decisions. It's best not to have a board or any other decision-making group that simply takes one perspective. You want multiple perspectives to get to the best possible solution, the best possible policy. And that's what we need in the case of policy responses to an emergency, like a pandemic. Fourthly, policies need to be flexible in the sense that they can adapt to new information. As information changes, the policies can adapt, so we keep updating our policies. And we've shown in the first couple of videos in this lecture how that may be problematic for government, that it can be difficult for governments to change track or to choose the best policies based on the information that they have when they need to convince the electorate that they're doing the right thing. We need institutions to try and enable that flexibility to adapt. And we need policies that are not just desirable, but incentive compatible. Incentive compatibility is a key element of a range of parts of economics. For example, the design of regulations, the design of contracts, any institution where you can't police perfectly whether a party is doing exactly what they're meant to be doing. And we need to recognise that with regulations, with interventions, such as the sort of interventions we've seen with COVID-19, that if they're not incentive compatible, if we simply say you will do this regardless, people will recognise that not everyone can be locked up, not everyone will be caught, not everyone will be fined, and they will simply use the loopholes, they will take their chances and not respect the policies. So we need to make sure that as much as possible, policies have public buy-in and that they're self-enforced. That individuals see, yes, this is a sensible thing for me to do, and this is the best thing that I can do for myself, for my family, and for my neighbours. And really, when we're talking about incentive and compatibility, we're talking about making sure that policies are designed to take into account those endogenous behaviour changes by individuals. That when you put rules in place, individuals will change their behaviour. But they may not always change their behaviour in the way that you expect. Or, if you don't put regulations in place, but individuals see a change in circumstances, say due to a pandemic, their behaviour will change. So really what we've got to think about when thinking about policy design is what will this policy actually lead to? Not what will it theoretically lead to, not what would it lead to if people behave like automatons, but what will it actually lead to when we take into account people's behavioural change? And incentive compatibility means that we can derive and design policies that are sensible and lead to desired outcomes, taking those behavioural changes into account. So, undoubtedly that is an idiosyncratic list, and undoubtedly everyone watching this video will have alternative suggestions for what we need to do to prepare for the next pandemic or natural disaster or global financial crisis or whatever it happens to be. But I think one of the things we need to have after this pandemic is brought under control is a debate about how to make our societies more robust. We've seen that some societies appear to be more robust than others. The United States, unfortunately, appears to have been quite dysfunctional from a policy perspective. But Europe also seems to have been relatively unsuccessful in dealing with the pandemic. But after the first wave, it opened up too quickly. It didn't take into account the risks of opening up. A bit like the story of the grasshopper, played music all summer, and then when winter came, Europe ended up in trouble, and they've gone back into a second lockdown. Australia, New Zealand, maybe we were lucky, but I do think that our policy responses were more nuanced, and hopefully as Victoria is now literally in the process of opening up, that nuance continues and they don't rush things. I've mentioned work from the US, which looked at what industries should be opened up when. We looked at that last time. And I get a bit concerned when there seems to be a rush to, for example, open up indoor dining, indoor gymnasiums and so on. Industries that may have a very small economic benefit but run a very high risk. Now, if you're running one of those businesses, yes, you want to open up, but the government needs to make decisions at a higher level. Thank you for following this course. And for the last time, have a great day.